Good day and welcome to Living Well with Adena. My name is Dr. Kataka and we're thankful that you're joining us today. First off, for those of you who've been patient with us, thank you so much for sticking through this. We've had some minor technical difficulties. As good as technology is today, every once in a while we fall into some bumps. Today we're joined by some great physicians today who talk to us about depression and anxiety. As you all know, we've been living through some very challenging times with the pandemic that has affected nearly everyone in the world. And on top of that, the racial tensions that have also developed, that has caused a lot of anxiety and challenges. And so to help us to manage that today are two physicians from Adena Health System. First, I'd like to introduce to you on my left, Dr. Amy Maggard. And then as well as Dr. Janelle Eisen. Thank you for both being with us today. We're glad that you're here to share with our viewers some thought-provoking things that will help them in their day-to-day lives. So Dr. Maggard, could you start off by just telling us a little bit more about yourself, where you're from, and what you do at Adena as a physician?
Yeah, my name is Dr. Amy Maggard. I'm an outpatient pediatrician here at Adena. I work in our Waverly outpatient site as well as here in Chillicothe. I'm actually from the area. I grew up in Athens, and so it's nice to get to work close to your hometown.
Thank you very much, and welcome to the program today. Dr. Eisen, tell us about yourself.
Hi. Yeah, I'm Dr. Janelle Eisen. I'm a psychiatrist at the Adena Counseling Center here in Chillicothe. I, too, am actually from the area, grew up in Latham, Ohio, in Pike County, so it's nice to be serving, my hometown and being close to home again, so.
It's fantastic to have folks that grew up in Southern Ohio join us. I think there's an advantage to, you know the folks and you can better understand some of the things they're going through. And we've been through a lot. Many of you have probably had significant others or family members that have lost jobs. Certainly, you've suddenly turned in your kitchen into a homeschooling area, and you've had maybe more children at home for longer periods of time, and you might indeed be working from home as well. So, Dr. Eisen, let's start with you first. Given all of those scenarios, what effects would that have on the average person living in Southern Ohio?
Yeah, so definitely seeing a lot of effects on people just in general. So, especially the population that might already be experiencing some depression, anxiety, and even people who have no history of seeing that. There's more stressors just in life. There's more isolation. People are worried about financial stressors, income, when are they going to get called back to work, but also trying to juggle working from home potentially, or homeschooling children, so suddenly teachers and all that kind of stuff, the responsibilities that come with being a parent. So there's a whole lot more, I feel like, put on people just in general right now, so feeling the stress of that, but also the uncertainty and the isolation and lack of, it feels like, social support with our loved ones, because now suddenly we can't just pop over to mom and dad's house or go visit a neighbor if we're feeling alone or sad. So, there's a whole lot of, repercussions of that we're definitely seeing more and more of just in the world in general, but specifically in this population. So
Dr. Eisen, some folks might not recognize that they wake up one morning and say, I have depression, I have anxiety. So what would be some of the manifestations or some of the symptoms that people might be having that would suggest they're having those difficulties?
Right. So that's a good question. So, and I get asked that a lot of, what should we even be looking for to know if this is something that is a problem? So sometimes it can be such subtle changes that, I could see where most people might overlook it and think, oh, this is just normal. So sometimes it's just sleep changes. Are you sleeping more than you should or less, feeling more tired, fatigued throughout the day, appetite changes, feeling down, sad, lonely, helpless, but also with anxiety, you can see irritability, you can see mood swings, just feeling more on edge in general. So there are a whole lot of, symptoms that can very easily be overlooked because it might be chalked up as just, oh, this is normal. But sometimes it does get a little excessive to where, people are having a difficult time even just doing their everyday functioning, activities that, would require us to take care of ourselves and our loved ones. So, it can be very mild, but it can also be extremely severe too. So there's a whole spectrum of things that, you might be looking for, seeing that are changes.
Thank you for that description. Yeah. Dr. Maggard, as a pediatrician, you see children. Would children have different manifestation of anxiety and depression? And if so, what would we need to look out for there?
Yeah, children can have some different presentations. Some of them could be similar. They could also have some sleeping issues. Maybe they were sleeping through the night and now they're waking up a couple of times through the night. Maybe they're having nightmares. They could also be more moody or overreacting to things that they might not have been bothered by before. They could also have maybe physical complaints like a headache, a stomach ache. Those could be signs of stress for kids.
So, not every child would obviously need to come in and see you for anxiety and depression. What would be your recommendation to a mom or dad or other caregivers that they could do to help a child through some of these episodes?
Yeah, one of the best things to do or first things to do is talk to them about it. So, see what they're feeling, what they're worried about, what they're thinking. Try to have an open conversation with them. Listen to what they're saying. Try to talk to them on their developmental level, a way and they might understand. So, talking about their feelings. Also, for kids, routine can be important. And when we've lost a lot of our normal daily routine, sometimes setting some sort of a routine can be reassuring. And it doesn't have to be anything really rigorous. It could be lunchtime the same time every day, starting your bedtime routine the same time every day, letting them have choices throughout the day. Like they might not get to choose to go see grandma, or they might not get to choose to go to the swimming pool, but they could choose what game they play. And then activity is really important for children as well. So getting outside if you can, playing if you can, and if you can't get outside, think about fun things to do inside, whether maybe it's arts and crafts, or you could find a fun like a yoga kid-friendly video, or let them lead exercises, because activity and exercise can really help.
So it sounds like consistency really is helpful for children in these in difficult times. You mentioned a word, and I'd love for you to explore that a little bit more. But you mentioned developmentally appropriate.
Yeah.
So by that, do you mean that we talk to 5-year-olds differently than we would a 15-year-old? And how do we determine what is appropriate for someone's age?
Yeah, definitely. So you want to think about how old they are and what words they might understand. So obviously, the 15-year-old, you could use bigger phrases. They might be able to explain things better. The younger children, not so much. Like trying to explain to them in a way they might understand stress or worry. Maybe you could use books or like a familiar TV show that they might understand or be able to reference.
Thank you, Dr. Maggard. So, Dr. Eisen, Dr. Maggard talked to us about what some things that children could do before they have to see a provider. Obviously, not everyone does. What are some things that adults or the general population could do to decrease some of those things that you mentioned they were experiencing?
Right. Yeah, and it winds up being pretty similar to what she had discussed with children. For all of us, routine tends to be very important. So obviously structure has been kind of lost or at least fallen apart a little bit during the huge changes that we've had. So trying to have a good routine, I encourage people, hey, try to go to bed at the same time. Even if you don't have to wake up to an alarm at 6 o'clock in the morning, it still may not be a bad idea to stay in that routine, doing your evening activities as normal, planning to have dinner with the family, and maybe exercising and showering at the same time, things like that. Just to help keep that normalcy, because we know just as human beings in general, we tend to thrive in times of routine. Also trying to increase your support the best that you can, so maybe reaching out to family, loved ones, however that's possible, even if it's FaceTiming them, or giving them a call on the phone, or texting, checking in with friends, that kind of thing. Those are pretty big things, just because, obviously with feeling alone during these times tends to exacerbate some of the symptoms. So just trying to reach out and, find that support.
Thank you for that.
Yeah.
So, Dr. Eisen, let's say I do all those things,
Mm-hmm.
right? I do my best to get in some kind of, I'm eating at the same time.
Yeah.
I have, hopefully, our children are going to bed at about the same time, but I'm still struggling, right?
Okay.
What would be an indication that perhaps I should reach out and talk to someone, or what would I need to do, and when would be the warning sign that I better do something?
Okay. Yeah, so generally, if it is starting to impact your everyday functioning, so you're finding it more difficult to do things that you used to be able to do without much difficulty. So generally, we don't tend to be the best judge of our own, character or how we're doing just in general. So a lot of times it winds up being, a loved one or someone else pointing out, like, hey, you seem like you're a little off these days. Are you doing okay? So a lot of times I encourage people to at least be supportive in the sense of helping a loved one point out maybe that they're not doing quite as well as they were before or seem to be struggling. But if you do notice it even in yourself, then I would advise you to maybe bring it up to your provider. So maybe, schedule an appointment with your primary care provider and just say, hey, I'm a little bit concerned about this. Is this something that, I may need to seek treatment for? Or is there something that you, advice-wise, could give to me to help? And they can help lead you the right direction. So
This is a question perhaps for both of you. Oftentimes there's some stigma associated with mental health. When it comes to diabetes, I don't think that anyone really faults someone for having diabetes, right? And just try harder and you won't have diabetes anymore. But when it does come to anxiety or depression, sometimes we have different thoughts about that and stigma. And so what would be your advice to folks who are afraid to seek that out because of the stigma associated with depression or mental health?
Yeah, and I definitely hear that a lot. And, it is unfortunate that it tends to still come with that stigma. But I do feel like trying to normalize it the best that we can. And I hear of a lot more people now saying, oh, I feel like it's more recognized now and it's more accepted to have some sort of a mental health, illness. But I think that the big thing is trying to remember that it really is no different in the sense of it being from a medical, disorder versus a mental health disorder. It's something that is very common, and, it's not anything that you should feel that you should be ashamed of or embarrassed of. But I think the big thing is helping normalize it. So not necessarily, telling someone just get over it, or, walk it out, or, snap out of it kind of thing. So I think that's the biggest thing, is just watching our words and how we approach it with our loved ones just in everyday life, and just letting people know that, it's okay and there is help. So
Would another way of putting that, Dr. Eisen, would be that someone's not crazy for seeing a psychiatrist or a family physician or pediatrician for mental health?
Absolutely.
Yeah. So, Dr. Maggard, tell us a little bit about if you've sensed that a child really would benefit from seeing a professional to help them through stress or anxiety related to the situation that we're currently living in or not. How would you prepare a child before the visit?
Yeah, so I would talk to them about going to see the provider and try to encourage them to be open and honest about what they're feeling to the provider as well, because sometimes it can be hard to relay that to somebody. You don't see that often. So let them know, that you're going, what your concerns are, and what the questions they might ask. A lot of times there can be different books you could read to children about going to the doctor's office, what it might look like. And then one thing now that would be good if you're going to bring your child in is to talk about the masks, because a lot of times we've been running into younger kids, or if they've been isolated for so long, they're kind of surprised to see all the masks. So letting them know that just because somebody has it on, it's okay. I know it looks different, but it's just a safety precaution.
And Dr. Maggard, when you're seeing children then, and you realize that it's for anxiety or depression, do you talk with the child alone? Is there a parent in the room? What does that look like?
I usually always have the parent in the room. Sometimes maybe with the adolescent, they might be more open about their concerns if they do step out, but that's something I kind of discuss with the parent and the patient in the room. And a lot of times at that older age level, the parents offer to step out because they do kind of feel that same way, that their adolescent child might have more to say to me than they feel comfortable saying to them, and that's okay. But the younger kids, the parents are usually helpful in getting them to be able to answer questions.
And what about a visit in your office, Dr. Eisen? What would that look like for a patient? And if they wanted to bring someone, could they? Talk us through what that looks like.
Sure. So normally, if someone feels more comfortable having a loved one come in, because like I said, sometimes we're not the most insightful when it comes to our own symptoms or, everyday life. So it is helpful to have, a loved one's perspective. Now I know currently there are some restrictions with bringing someone in. So unless you have a caregiver or need the assistance, then generally people are coming in alone right now, unless we're doing telemedicine appointments, which I am doing. And if they choose to have someone, on their end, that is completely fine. I always encourage them to at least talk to a loved one and report that information to me when they come to the appointment, because that really can be very valuable. Because I do hear a lot of, well, I don't see a difference, but, so and so said they're seeing this. So that is definitely helpful.
Thank you.
Mm-hmm.
Dr. Maggard and Dr. Eisen, images are very powerful, both to adults, but especially to children. And we know that there have been a lot of news coverage and images on social unrest, rioting, demonstrations, some peaceful, some not so peaceful, how would you start to have a conversation with children about what they're seeing on television and about the social unrest that we're seeing, not just in the United States, but really across the world now?
Yeah. So with children, you want to be careful about what traumatic or intense images they might see. You might want to try to limit how much of that they're seeing on the TV, but you do want to have a conversation about what's going on. I don't think it's ever really too early to talk about race. With kids, with little children, you could notice differences because kids pick up on differences, whether it's hair color or skin color, and to let them know seeing differences, noting differences, that's okay. And just to emphasize that just because somebody's different does not mean they should be treated differently. For older kids, you could talk about history, the history of the United States, whether it's going through slavery or the civil rights movement or ongoing movements for justice or social justice. And that would help explain why some people might be so upset or why there's this feeling of need for all these protests.
Thank you. Dr. Eisen, along the same vein, oftentimes we'll have very strong different opinions about the same subject. What advice would you give to folks who are feeling that they're getting upset about either what they're hearing or about views that are opposite of what they believe or they believe should be the way that they should go? How would they manage through that?
Right. So I think it's important to talk to people about limiting exposure. So, I try to focus on, though I've stressed a couple of times already how important it is to increase social support and try to stay in contact with people. But at the same time, too much exposure can be bad too. So if you notice that, you're being, triggered by watching too much on the news because it's so negative, or on Facebook, you're finding that you're getting into arguments with people because you disagree about their opinion. It's okay to have your opinion. It's okay to disagree, and they're, entitled to theirs as well. And so I try to emphasize that, but also maybe say, okay, so what can you do in order to cut back on how much distress it's causing you? Because ultimately that's what, I care about, is that you're functioning and doing well. So if you find that it's impacting you in such a negative way, then maybe you need to decrease your exposure to it. So cutting back on how much time you're spending on social media, how much time you have the TV running, that kind of thing. And that way, you want to be informed, but you don't want to be, overly distressed or, distraught about the situation. So limiting the exposure, I think, is kind of key with that.
Thank you very much.
Yeah.
Sometimes it's even within the same family,
Mm-hmm.
right? So that famous Thanksgiving dinner, when you have differences. Any advice there? If you have the mashed potatoes are being passed, but
Right.
there's differences in opinion.
Yeah, I don't want to say don't go, because obviously, it's important to have family time. But at the same time, I think trying to, think a little bit ahead in the fact of, well, what do you expect to get out of it? So, is it going to pay off to be confrontational or to, express your opinion on this, situation, or is it just going to cause more turmoil? So, again, you're going to find those conflicts and those disagreements, even amongst your own family. And, the whole point is to be there for your loved ones and spend time together, but maybe it's not going to pay off to express your thoughts or opinions on something that is going to just cause, a food fight.
Thank you. I want to turn, we were reading something on this. There's a CDC study out, and that the CDC is noting in their study that women feeling stress more than men, about 35% compared to 26%. Does that surprise you at all, Dr. Eisen?
No, it doesn't. Just statistically, we know that women tend to have more mental health disorders than men. That's just something that we've known just from the data already. So it's not necessarily surprising that with the uptick in numbers because of the pandemic that women are more affected than men. And I think a whole lot of things go into that. We know that hormones and chemical differences between men and women puts women at higher risk. Also things like, pregnancy and the stress that comes with that and the uncertainty and changes with everything related to pregnancy right now. But also, a lot of times, women do tend to be more of the either primary caregiver or one of the very involved caregivers for the children. Children are home from school right now, all of these things that go into it as well, plus balancing potentially, working or, taking care of the home or whatever it is. So I think it's just a combination of a lot of things, but the fact that women are already kind of more predisposed to have those disorders, it doesn't necessarily make it very surprising in that sense. So,
Okay.
yeah.
In 2019, Adena participated in what's called the Community Health Needs Assessment. And it's something that we do every 3 years, and we coordinate that with other agencies within the area. In this needs assessment, we found that 38%, which I was actually surprised, of the respondents believe that depression and anxiety is the county's top community health concern. And 41% actually see mental health education for children as a needed health education topic. What are each of your thoughts on where we stand in the region as terms of mental health needs and opportunities for adults and children? I'll start with you, Dr. Maggard.
Yeah, I would love to see more mental health support for children in our community. Sometimes to be able to get children and to see like a child psychiatrist or up to children's, it can be 8 months. It can be a long time. Sometimes to just get them from the office visit into counseling can be weeks to months out. So we definitely need more support. I would love to see more support for kids in our area.
And Dr. Eisen?
Yeah, and speaking obviously to the adults a little bit more, I feel like at the counseling center we do have a pretty wide range of services that we have to offer, which is really nice. We're pretty well staffed with prescribers, which is great, especially in this area. You don't see a whole lot of that. We have 3 full-time psychiatrists and a psychiatric nurse practitioner, and then we have, several psychologists and therapists. But primarily, it is aimed towards adults, so it's still lacking a little bit on the children. We do have some children therapists at the counseling center and child psychiatrist starting soon, which will be nice. And she'll be very busy, I'm sure. So, but yeah, I agree. I think that, definitely for children, it'd be nice to see more. I think that's kind of everywhere, unfortunately. For adults, I do feel like we have quite a bit of access for people right now. So that's great. And, we are welcoming, all the referrals and people coming in and see us because we'll do what we can.
So if someone wanted to reach out to Adena Counseling Center, what would that process be?
Yeah, so generally it's by referral of a primary care provider. So if anyone has any concerns and are wanting to be seen for whatever reason, just talk to your primary care provider. They send a referral to us, and we take care of scheduling pretty quickly. Like I said, especially for medication management, we can get people in pretty fast. Therapy, there has been an increase in demand here recently with everything going on, obviously, but we're doing our best and getting people in as quickly as possible. So having primary care send over a referral is the best way to get that going.
What would you say to someone who is suicidal? They're thinking about ending their life, or they're just in such a depressed state that they don't see a way out. And it's several weeks before they either see you or their family physician or pediatrician. What would be their outlets, or who could they reach out to?
Yeah, I would say, make sure that you ask for help, whether it be, calling the crisis hotline. There's even access through, like, if you call the counseling center to direct you to the crisis hotline. There's also, lots of ways that you can reach out just by a loved one and having them help you get in touch with someone. But there are so many ways to get access to be seen or get help or get to the place that you need to go. even if that includes going to the ER to be seen, that kind of thing. There are a lot of different options. So, just don't be afraid to ask for help if it does come to that.
Thank you. Thank you very much. So, with so much going on, how do we identify what is worry versus what's anxiety? Right? It's kind of natural for all of us to worry. Can you help delineate that a little bit?
Yeah, so I mean, worry is a symptom of anxiety, and so those kind of go hand in hand. But there is a normal amount of worry versus an excessive amount, to where it does manifest much more like the anxiety disorders that we talk about. But, a little bit of worry is normal. And I tell people, if you're not worried, you're probably not normal, or you're over medicated, because, there's a lot of stress and uncertainty in general right now. So that's normal. But like I said, the big thing is it interfering with your ability to do things that you need to be doing? Are you finding that you're having a much more difficult time making it through your day or being present for your loved ones or at your job or whatever it might be? Are you not sleeping because of it? Are you not eating because of it? Things like that. That's when we know that this is much more of a disorder that we need to, seek treatment for.
Okay. Now, we've talked a lot about children and what to look out for. But let's talk about the opposite end of the spectrum. And particularly with the coronavirus, there's been a lot of isolation with our elderly population. Even you see those on the news, those stories of the nursing homes where the family can't visit. What effect, first of all, what effect has this had on our elderly population? And then how can we help them with the isolation? You mentioned earlier we can't go visit them. So what are some things we could do? And what are some things that children could do to help, their grandparents and those types of things? So we'll start first with you, Dr. Eisen.
Yeah, so it definitely is impacting that population to a significant degree. And two, I think, just knowing statistically, that they're a high-risk population for the coronavirus and the prognosis associated with it. So I think that in general tends to cause a lot more anxiety in that population, but also having to isolate more and stay home more. So even with doing the telemedicine appointments, some of them via phone call, I got a lot of, oh, I'm so glad to talk to you. I haven't gotten to talk to anybody for a while. And so just something so simple. And it would always make me think, oh my gosh, have I called Mammy lately? That was like the first thing that came to mind, because it's one of those things that, that, we all know that this is happening, but sometimes we tend to get so involved in our own situations and our own lives that we forget, like, just pick up the phone and call them. And, and if you can visit from a distance, we've done the, play date out in the yard kind of thing with a baby, things like that, to where it's like you get to see them, but, you may not be able to hold them right now, but soon, that will be changing, hopefully. Just things like that, trying to do what you can to where they know that you still care about them and you're still there, and just check in with them and offering to help them. They probably shouldn't be going to the grocery store or going out and doing normal errands that they are used to doing. So offer to do it for them. Things like that can go a long way.
Ideas that you have for children?
Yeah, if grandparents are able to FaceTime, that would be great. If they can do it and the kids can do it, because sometimes the younger kids can struggle with it too, being able to look into the phone. With the telephone call as well, letting your kids talk to them, visit with them, put it on speakerphone and let them interact. They can also draw pictures, make crafts, send letters, that can be delivered there to them. Those would be good ideas.
Thank you so much. Let's turn our attention now to if an individual doesn't have anxiety or depression, but someone that they know or love, a spouse, a child, a parent, they really do see those changes, and it's pretty obvious to them that they're suffering from anxiety or depression, but they don't want to see either one of you or do anything. What's some recommendations there? How do you help that person to really seek help and get better?
Yeah, and I think, again, just helping normalize the situation. So, trying to be supportive in the sense of, it's okay if you're feeling more down or anxious or, you're struggling a little bit more. This is normal. This is common. It's okay. I'm here for you. Also, just trying to get a better insight on, what exactly they're feeling in a supportive sense, to where you're not necessarily condemning them for feeling that way. It's not, oh, snap out of it, or, why can't you feel better, or, oh, well, I felt that way once and, I'm fine, that kind of thing. It's more of, okay, well, tell me how you feel and why, is there anything that I could be doing differently from a supportive, standpoint of, I want to help you, but try to talk to me the best that you can so that I can, understand a little bit better about how you're feeling. And then, trying to point them in the right direction. It's okay to go see your, provider and talk to them about it. It's okay if you need to see a therapist, and I think just trying to let them know that you're going to support them regardless, and that you are there for them, but also not necessarily to make them feel bad about how they're feeling. So
Yeah, and I think sometimes in the adolescent population, more so, the parents might notice things and they're not interested in coming in. They don't want to see me. They don't want to see counseling. They don't want to even touch on a medication, which is okay. It's an okay, normal feeling for some people to have. But for the parents, if you can just get them in the door and let's have a conversation and let's just talk about it, sometimes that can be the first step, because hearing things like talking about the stigmas and talking about that you're not crazy for being here, like these can be feelings people go through, that's important. So sometimes there can be that hesitation as well from them, but and then getting a rapport too, like maybe they won't see counseling but they'll come back and talk to me in 3 weeks, and then developing that often can be the first steps to just getting them to admit, okay, something's not right here.
I think that's also why it's important, particularly from a pediatrician perspective or family medicine perspective, that your patients come in and see you regularly for the well child checks and develop that relationship with you, right? And that you'll get to know them. Are there examples where you've had actually a child or adolescent come in and you've noticed something was wrong and asked a few questions and discovered that there was something going on?
Sometimes we'll have med checks for other reasons too, like ADHD. And if you talk about school or how things are going, I've seen sometimes other feelings come up. And as well for the well checks, when you're going over, well, how's school, what activities, how's sleeping, how's eating, when people sleep too much or not enough, eat too much or not enough, or, well, I used to play basketball and all these sports, now I don't do anything. Like those can be signs like, okay, there's something more here that's going on.
Thank you. Thank you. Well, we're about running out of time, but there's a couple more questions that we'd like to go through before getting your final remarks. So it's true, right? With more people working from home, there are couples spending more time together that they may not have normally spent together, right? And that can be a wonderful thing and sometimes be stressful, right? Any advice, Dr. Eisen, you have for couples who are now thrusted together that normally wouldn't spend 24/7 with each other?
yeah. Absolutely. And I do hear a lot more of the irritation that people are finding with their loved ones because they are stuck in a house and they're getting a little bit of cabin fever together. So that's normal. So just know that it is normal and it's okay. And, we do tend to take out our frustration and our anxieties out on the ones that we're closest to. So if someone is taking out their irritation, annoyance with you, then it's probably because they love you. But at the same time, I think just trying to, work together and say, I'm sorry, I'm a little snappy right now, but, you're kind of getting on my nerves, or, we have been together a lot here lately. So let's try to go do some separate things in the home, and then reconvene later. And that's okay, just to kind of take a break, even if it's in the same household, maybe different ends of the house or whatever it might be. Go for a walk outside by yourself. That's okay. So
you're mentioning a little bit of physical activity, which is really leading us to the next question, right? So they're asking, can physical activity help with anxiety or depression? And if so, why? And from your perspective, and then I'm really interested from why is it really important for children to get that physical activity?
Yeah, absolutely. We know that is definitely a very positive coping skill, and it's a good way to get out the physical manifestations of these mental health disorders. And it just does have a way of fatiguing the body in a good way, to where it can normalize the anxiety, insomnia, that kind of stuff. Also, the endorphins that you do get from physical activity does help chemically with depression. So there's a lot of positive benefit, and then the self-esteem aspect that can come with it, that feeling of accomplishment and just feeling good about yourself. So a lot of positive mental health benefits with activity. Absolutely.
Yeah, and for children, they're so active and they have so much energy. And a lot of times at school, they've got gym or they've got recess or maybe they had their sports, and now all of a sudden that was taken away and they're home. So they've got to find a way to get out that energy or that activity. And that's why keeping up with that, even when they're at home, can be really important for them because that can help keep things more normalized for them as well.
Awesome. Thank you. Thank you so much. So we appreciate the time that you spent with us today. Dr. Eisen, any last minute thoughts that you would like to share with our viewers regarding anxiety, depression, and the topics we've talked about?
Yeah, and I think the big thing is, and the take home message from me would be, you are not alone. A lot of people are feeling some of some similar things that you're feeling, and it's okay. And, if you're struggling, that's okay. There's help. So please don't be afraid to reach out and understand that, you're not being judged, you're not being ridiculed because of, feeling like you're struggling a little bit more. It's no different than going to your primary care doctor for your, high blood pressure, cholesterol, or whatever it might be. So please know that there's help out there, and, we would love to talk to you if there's something that we can do to help. It's what we want to do. So.
Thank you.
Mm-hmm.
Yeah, and I would just say if you're noticing as a parent or a caregiver that you're feeling stressed or anxious, know your kids might be feeling the same. They might just be showing it in different ways. So talk to your kids about it, be open, have that conversation. And if you feel concerned or notice concerns, come in and talk to your healthcare provider.
Awesome. Well, please join me in thanking both of these wonderful physicians for spending time with us today to talk about anxiety and depression and those challenges that we face. We're grateful to both of you, Dr. Maggard and Dr. Eisen. Thank you very much for your time. We invite you again to join us on Living Well, Adena, on July 2nd. The topic there will be physical activity, which we've talked a little bit about today. And you might be able to tune in and learn some things that you can do to keep you healthy and safe. Until next time, thank you very much.